Welcome back if you're just joining us. This is the Morning Star, and it's coming to you live and direct from Star TV. And of course, like I said, we were expecting to have Sainabou. Sainabou is with us in the studio. Sainabou, you're special treatment. Anyway, you're supposed to have special. But anyway, Sainabou is a project coordinator with the Gambia Health. The Global Health Network, and of course, she is an accomplished, geneticist with a deep commitment to advocating global health and promoting genetic literacy in the Gambia. And she is right now with us in the studio. Good morning. How are you doing?
Good morning. I'm doing okay. How are you doing?
Yeah, I'm fine.
Very okay.
Yo Lord of Nunla, Lord of Nunla, Lord of Nunla. Yo so near Samala like Banyaton. Yeah, you're Lord of Bar. But we're glad to have you, and we don't anticipate because this topic that we are to talk about is very important. I'm sure thousands of people out there are definitely watching things that have to do with human genetics, so, and then Gisnanjets and the association as well, the Human Genetics Awareness Association and the like. So can you tell us briefly about this? Start with getting to know what is it exactly.
So to start with, you have human genetics, you mean February donor. You are bunga hamantene yanko I'm from Sayak Papa and they pass it on to you. Febar bunga hamantene mungi sen family. So febar bunga hamantene maybe some mom amnako, uncle, auntie, and then the amko. So there's February donor my human genetics. And so we say mamuna tahaw finite or mamuna talk fite rather will explain what human genetics is because I have at least the qualifications to do so.
Yeah.
Right. So I'm now a bachelor's in molecular biology and genetics and a master's in genomic medicine as well from Oxford. So that has allowed me.
Because Sainabou Laye Ndure, an accomplished geneticist with a deep commitment to advancing global health and promoting genetic literacy in her country, the Gambia. Currently serving as project coordinator with the Global Health Network. Sainabou works on genomics.
Yeah.
Works on genomics project across Africa, contributing to transformative research initiatives in regions. She is also the founder and the chairperson of the Human Genetics Awareness Association, an organization dedicated to raising awareness and disseminating genetic diseases in the Gambia, highlighting her dedication to both science and community advocacy. Sainabou's academic journey is equally inspiring. She earned her master's degree in genomic medicine from the University of Oxford, having been awarded the prestigious AFOX Mastercard Award, a fully funded scholarship. Prior to this, she completed her bachelor's degree in molecular biology and genetics at Eastern Mediterranean University, and where she graduated as the top student in the development of biological science in July 2020. Congratulations!
Thank you very
much.
Wow,
that's impressive. Also on a scholarship. Her time in the academia not only honed her expertise but also deepened her passion for human genetics and translational research. So with hands-on experience in building and managing human genomic database from her time at Oxford, Sainabou's research also includes work on SARS-CoV-2 during her tenure as a scientist officer in the genomics platform at the Medical Research Council in the Gambia. Her contribution to scientific research are driven by her passion for capacity building, especially within African healthcare and scientist communities. The list goes on. Nananga say that we recommend a strong advocate for women's empowerment and knowledge dissemination, Sainabou is committed to breaking down barriers in science and healthcare. Her work continues to inspire a new generation of African scientists as she bridges the gap between the global health initiatives and local communities. With all these accolades, Nakala Gambia is celebrating. Have you been celebrated? You need to be celebrated because with all these accolades, this is inspiring. I'm impressed.
It's an accolade. I mean,
really?
As long as I get the audience to listen,
yeah.
Because at the end of the day, linga wax ni yep do am ben jering su fekke gene wo mako ci man ma share ko with the people.
Exactly.
So that is one of the main things because comme ni ko waxe rek li nga go through non yep man kena suma nekké man kena duma amal jering.
Dama da gis time bo so intelligent nga smart trop gaay asabi say this man you na buku man why you are a buku man then yow da nga jël li yépp Sainabou ndaf nga def ba jangal li yépp
jang daf ma neex nak lolo thing bi so I love to learn. I like to learn new things and be always janga always make sure ne ma ngi xam luy xew di seet lan lay yokk si lu ma xam already di seet tam naka lay mën a dimbalee ñu nga xamante ne maybe xamuñ or amuñ privilege to be in the same position that I have been nga gis ne dinaa ko mën a share ak guys.
Yeah, before you don't read some biography, you know, don't start. But briefly, like you said, this Human Genetics Awareness Association being founded because the mission is to raise awareness of the prevalence of genetic diseases in the Gambia, to promote dissemination and to provide psychological support to affected individuals and their families. So this is the mission. Tell us some more.
So dinga gis ne like you've said already the main thing mo neka to raise awareness about genetics about human genetics so kan mo ko don waxe before mo neka febari dona because dinga gis ne Gambia am na ñeneen ñu nga xamantene dañ am yena febar that xamuñ sax ne genetic disease la mun na am nga assume ne maybe xale bi dafa am rab I'm speaking mostly on children mun na nga gis xale yi nga xam ne dañ foog ne dañ am rab o jine moo leen
ñun loolu lañ déggoon di dafa am rab jine ko jàppa te di mën a am sometimes serious consequences yóbbu xale bi si géej pour sanga ko xam nga jine bi dem tëj ko si néeg bi ak ay saxaar jine bi gën a wax sax fi ko yóbbu fa la ko jële jine yi ci géej gi lañ dëkk ak yooyu noonu
waaye xam nga wax bi mooy am not saying ne loolu amut
non dama dañoo assume
am na
dañ dee gis loolu
dañ ko dee gis kay so di nga gis ne que what I'm saying is I'm not dismissing ne what they're saying or luñ nekk di claim mo jot xale bi but lu ma wax moo nekk there's a chance ne xale bi tam genetic disease la mun a and soo xamee ne lii nii maybe disease la nekkut rab bi nekkut jine bi then that's where the psychological support comes in understand because nga gis ne waa koñ bi maybe ñu jàppale la si xale bi ñu dimbale la because most of the time ñu dee am façon xale yi dañ leen di mën a isolate ñu nekk ñoom kenn duñ xam nu ñoo def so at least with knowing that di nga am the support that you need.
That's very true. That's very true. Fan ngeen ci tolloon parce que last time gis naa ngeen am organise benn defin ba yéen a ngi bindoo nit ñi ñëwoon nañu cover event bi and the like. So how far have you gone?
So now what we have done so far is we tried to do courses online. We had a November series, it was a month long, where we taught about human genetics. So it was myself and another colleague from Oxford that did the course. The doctor, nurse, you could attend. And then we got very good feedback from Nini because they liked what they got to learn. But the only issue is at the same time, afterwards, doctors here, nurses, they reached out and told us, okay, it's very important because jangal nenyuko, why jangal nenyuko buba. So there is also that gap that needs to be filled, and it's also one of the missions of the association to teach nurses, doctors, high school students, university students to try to fill in the gap of this genetic knowledge that's missing. So that's one of our aims as well, and to promote genetic testing because genetic disease la am or not, so test. So it's to promote the inclusion of genetic testing in our facilities and also the creation of a genetic database as well in the country.
But general diseases as far as genetic deficiency is concerned, because some large bari liñ ci gëna xam rek moy sickle cells for example. Ñu ci fa lañu jaar sa jaale suma ben jarbar parce que dafa gañu tayele mom dafa am sickle cells dafa gañu dem na am 15 years then mo doora gañ jarbar la won ci man ak yoy. So like sickle cells la nit ñi gën a xam.
waaw
but ndax nit ñi war nañu xam ne there are some more different from sickle cells. ak yeneen yoo xam ne mooy li ñu doon wax léegi ne jàpp na yëfi rab la wala yëfi liggéey la wala yëfi nangam pour ñu understand lii genetic disease la.
So comme ni nga ko waxee sickle cell is one of the main popular ones. It's very good that it's popular. parce que da gis comme ni commencé ni ko xam nanka. and nit ñi xam nañ ne léegi soo amee sickle cell or soo fekkee da nga your career or da nga sa family ñu am sickle cell war ngaa dem test to just prevent it in the future so loolu is very good start. waaye am na yeneen yu nga xamante ne genetics la so for example am nañ beta thalassemia xal na moo jege sickle cell tuuti because also like similar. am nañ the spinal muscular atrophy. Might be not so famous, but there's another association called the Remembering Rural Foundation, and they're working on something like that. And dinga gis ne bobu nonu dafa nek feebar bu nga xamantene xalé bi by the time mu am 2 or before mu am 2 mun na gañu.
Bobu muy waxat ko muy
spinal muscular atrophy.
Okay.
So da nga gis ne xalé bi by the time muy gañu or before muy gañu du mëna tok du ram du def dara dafa just tëdd rek. So then come because of cases those are typical ones you need to fuck ne rabla because xale bi du def dara.
am na fu ma la war a yóbbu de. I'm serious.
So loolu la
am na fu ma la war a yóbbu am na xale boo xam ne. dinaa try nga gis ko.
Okay.
Because li nga describe nii moo nekk ci xale boobu.
So loolu la day nekk. xale bi dina dem ba 2 like I said most of the time before the age of 2 du toog du raam du dox tëdd rek la because there's a problem with their muscles so duñ mën a def dara. So sometimes even send boti dañ leen nekk di just move about and you
rawal li nga wax ni yëpp maa ngi xale boo xam ne loolu
so loolu noonu daf dee mën a nekk a typical sign of this one I'm saying and it's one of the ones that most of the time dañ ko dee mën a jaxase ak rab la mboota mënta toog o yaay dafa gën a timis moo tax xale bi exactly so that's one of the ones another one also moo nekk tëx like deafness some of them are genetic as well I think one of the obvious ones so that's like a few to name a few albinism is one. Albinism is one as well. So like sickle cell is inherited in what we call a recessive pattern. More mean fok yaay bi mu carry disease bi wa affect ko. Papa bi tam carry disease bi affect ko ga am doom then xale mu affect. So that deafness as well daf day mën a nekk the same. So di nga gis yaay buy dégga papa buy dégga nga am doom bu nga xamante ne mi mu te.
Doom bi du dégga.
Exactly.
Dafa fekk mu ngi woon ci papa bi.
Waaye
wala mu ngi woon ci yaay bi. waaye feeñutoon.
waaye feeñutoon.
So xale bi ñëw di feeñal ko.
xale bi ñëw feeñal ko. So albinism tam it's the same thing.
mooy puuna.
waaw
waaye pour mu leer gars yi.
non pour mu leer waaye xam nga
ñu war a xam dañu nga xam ne la.
lu ne xew rek moo nekk.
suma joolaa bi xëj na xamul albino.
waaw ok
albino mooy puuna.
xam naa
waaw pour mu leer.
waaye xam nga luy wax bi mooy. waruma ndax puuna is a word that they want to be called is it.
non waaw you're right.
so loolu moo tax I am a bit.
non dafa wax nga dëgg sax par ma dimbale la parce que people living with disability. You don't call them.
They're disabled.
You just call them persons with disability.
People living with disability.
Absolutely.
People with visually impaired person also. But puna, how ma leeruma but xam naa ne we can use it for now pour nit ñi understand that that's what we mean by albinism because ñu ngi create awareness so even su nekkee ñu ngay jégalu waaye fooguma ko sax fooguma ne waaye ñu ngay jégalu but lii la ci miin te nit ñi dañ gën a jàngal pour ñu mën a understand waaw
so boobu noonu tam is one of the genetic diseases so dafa nekk lu nga xamante ne feeñut si yaay bi feeñut si papa bi and then mu feeñ si doom bi
ma bëgg la cee laaj am solo parce que léegi-léegi ma dégg gars yi di wax deret bu jege lool daf dee cause genetic disease yi nii how true is this ñu bari gëmuñ ko surtout am na yenn xeet yoo xam ne ci réew mi fii ñoom lañ gën a xamee ci sëy yu jege yooyu noonu li ci mel ni saraxule li ci mel ni pël li ci mel ñëpp a ko dee def nag am na ñoo xam ne lii dañ ko xamee bot jege-jege bi mooy comme ñu bari soo leen ne dafa jege dañaa de ok doomi nijaay doomi bàjjen ñu ne jegewut ba da ngaa gis kii ak kii ñaari jigéen lañ ñoo bokk ndeya bàyyi seen doom yi sëy booboo gën a jege wala ñaari papa seen papa yi bokk ndeya bàyyi ngeen sëy booboo gën a jege daan doomi nijaay doomi bàjjen loolu lañ ko dee gisee bot dem naag ñëw na yëpp ndax dëgg la ne deret yu jege yooyu noonu daf dee cause genetic disease.
dëgg la it's true because li xew mooy in order pour ñu mën a xam nit ki ban genetic disease nga am foog ñu xam sa DNA so DNA is in every cell sa yaram bi so dafa mel ni instruction manual for your body so sa yaram bi lu mu war a xam yëpp sa bët ci nuñ war a mel sa skin bi color bi sa kawar bi yëpp is in your DNA code for example that's what it's called so léegi yow soo amee sa DNA code nga dem si ak nga xamante ne dafa jege ak yow torop daf dee similar a lot so similarity boobu noonu so leen sëyee su fekkee kenn ki for exemple mu ngi am benn feebar feeñut kon nuñ ko doon waxee keneen ki tam ñëw mu ngi am the same thing ngeen sëy because of ni ngeen jegeñee feebar bi daf dee mën a gën a garaaw because of that closeness. So it's called consanguinity, I believe it's pronounced.
Okay.
So if they gonna grawal fever, but fata fever the far thing. Because if I can yo sa family, and get a disease bunga hamantene and go carry te fenyut, right? You them say like benen family, maybe you amuñ ko tanga du feñ. Waaye su fekkee da nga say biir family bi te yéen am ngeen feebar boobu noonu dafa feebar dafa gën a gaaw a feeñ.
Dafa gaaw a feeñ.
So loolu am dee nekk nag it causes it to be more severe mu gën a gaaw a wane.
Interesting. Do you have questions balaa maa ñëwaat parce que man moom mën naa toog fi di ko laaj fii ba ëllëg.
Man I just want to add on to because it's something very educative. So it's not in our Gambian society full of the issue of this genetic issue. Because most of the time, most of them they want to come maybe Malaya say we're gonna have some genetic test so how important is that? Because most of the time we need to very full of with regards to come Malaya say we're gonna have some genetic tests and hamna you are compatible or no for them. So yen as an association, you can make people aware of such issues.
So from Nekani, again, we're doing most of the things online, right? But then the target is to actually go into the rural areas. So this coming on this talk is one of those things that we hope can actually make a little bit of a difference, and then actually go on radio stations like you know. But then to go back to the genetic testing, to do a genetic test, let's say currently in Gambia, hamna muna your testicle cell. By February, bari na interrupt. Okay. So unless mo nekk li nga xamantene maybe family bi xamé ngeen ko ñu ko bëgg dem test, that's great. But the brain problem bi mo nekk ndax ñu ko testangum biir Gambia. Okay. But then that's again one of the things that we want to promote to be done here. But so fekkee loolu that facility is not available. Comme maa ko doon wax moo nekk li nga def mooy pour ñu nga xamante ne mënuñoo am that ability nga xool family bi nga bëgg a def seeyal. Okay, so da nga xool family bi nga xool as far as seen maam yi seen maamati maam yi what do you think moo nekk a pattern in this family, right? So fekkee ñoom dañ di am maybe ndiga bu métti bu bari, maybe auntie bi uncle bi maam bi dañ di am some diseases that you see waa kër bi moom or waa family bi entirely. Maybe they have, let's say something like sickle cell. Then so if you test okay, maybe there's something here. So if you have no issue, you can look into things like that. So if you don't have the ability to test, so that's one way gauge the field. Because if you family maybe they have something similar, it might not be the wisest thing. Understand? Because maybe when I'm a child, maybe will be even worse than so that's just one of the examples, and I'm using digabubiti because it's the it's one of the things I can gauge, but more things than that, more things like that.
Okay. I have actually two questions. So what are some of the specific goals you aim to achieve as an association?
So one, aside from the one we've already said about the stigmatization and awareness and providing psychological support for the affected people, Monica will include this genetic testing in the healthcare system. Understand? Because I'm not fair to talk about what they've test, but so I'm definitely not tested in a halamiti. So it will be to include this genetic testing in our facilities. That's one. But also to have a database for it. Because so if I on a database, it could be an Amna and I don't know about it just yet. I could have just tapped into that and like, okay, Gambia Fidi, Yanyonek at the top 5 or top 10 genetic diseases, you report. Then I would just talk about those. Because I have not, or I'm yet to tap into that. We want to promote the creation of that database in the country. So that's another thing. Okay. And then the other thing is to provide the education. So the awareness is one thing, it's another thing to actually teach the people, the nurses, teach the doctors, teach people responsible for the people about human genetics.
Alright, as the project coordinator, what else? Have you ever worked on projects, or are you planning to work on projects? And how will these projects impact on the life of the public?
Are you saying in reference to human genetics and the association, or as the work, a job?
The work in general.
So with my work as a project coordinator for the Global Health Network, we have not yet done a human genetics project.
Okay.
We have done genetics projects, like genomics. So we have done like wastewater surveillance to see young diseases ñoo nekk ci wastewater pour mëna xam lan mo nekk ci population bi. That's one. Another thing would be to test, let's say, flights of people arriving, SARS-CoV, as well. We work on those type of data. But then those, my role as a project coordinator, I've not used that yet, at least to human genetics projects.
Oh, okay. All right. Thank you.
Living interesting. Interesting. Because mangi so try to say and then I realize chronic pancreatitis mangoges as far as genetic disease is concerned. And most interestingly as well, mangi is malaria. How how significantly that influence in individual susceptibility to malaria?
So the malaria one is a bit of a tricky one because, so malaria, if you're infected, it goes to your red blood cells, if I'm not mistaken, and people are more reproducing and spreads out here. Let's say I am a sickle cell carrier, most of I'm malaria. Because some of my red blood cells are okay, but the other half of them, I'm that sickle shape, like a C. So bad malaria parasite be. So the malaria. So the immune reproduce sickle cell carrier. You have both the good one and the sickle cell one.
Yes.
So the now malaria parasite needs that space in the healthy one to be able to go through all the stages you want to reproduce.
Yeah.
So it needs all of them to be healthy and very good so that it can manifest in there. If you have so be for them to spread very well.
Okay.
So there's a low chance that they get malaria. Not that don't have malaria ever, I'm not saying that, but the chances are slimmer.
Slim. So how about chronic pancreatitis?
So at the top of my head, I can't tell you much about chronic pancreatitis. I would have had to read up about it and then give you a bit more information about it. But to substitute for that one, you can look at kidney disease. Because kidney failure kidney issues. So there's one that is has some genetic aspects of it. I think it's called APOP1 gene. That's the gene that's usually looked into. So both it's genetic as well, so you can test for that to see your susceptibility. And yesterday I had another one, breast cancer. Breast cancer is another genetic disease that you can inherit, so they can check for that. It's called the BRCA1 or BRCA2 gene, and that inheriting a bone and that one you can get tested for.
Some of these diseases, what is paramount is counseling and psychological support. That I'm the cure. Not some of these things I'm the cure.
Yes,
that you only rely on the counseling and the psychological support.
So that's the difficult thing about human genetics, to be very honest. Currently, I would say currently, because in the future, it will be easier to find cures that we can do these things. Because what will happen is they will create maybe a vector or something that basic DNA will change error. So like I was saying, DNA is like an instruction manual. So let's say it's A. So if I say because they could replicate from parent to child, we could copy. The mistake instead of AAA, we have AAS. Error.
Yeah.
So error with you can tolerate in different ways. So if it's in a very important region, then you will have a genetic disease which is very serious.
Wow.
So if you tolerate, maybe do one year, or if you tolerate completely, then it's fine. The fact that like error so that's the other thing. So now also because of that depends on how can you cure it. It's very expensive to find some of these therapies. I read up about sickle cell that they were trying to find an intervention for, but the asking price was around $1 million.
Wow.
But then it worked for some time. I'm yet to do a follow-up to see how that patient is doing now. But I guess on symptoms at least wàññi ko woon nañ si HuGAA daf test boobu noonu.
So what is the situation in the Gambia? Is some of these things, is it on the rise, or with your advocacy programs and FOC, is it going down, or get serious with more cases, coming out?
So for one, we would need to test it first in order to give you the answer. But you can't test and check up.
What do they have in their system? What's in the data?
So that's the other thing. I asked a couple of my friends that are doctors and nurses, and when they were because we can't test angom, a definitive answer and for sure.
Okay.
So maybe with experience, when you're kid, for not fever being but because we can't test fee, okay, definitely understand. So that is one of the things that we need to work on, like I was saying earlier.
That's important. ñu ngi run out of time fu nekk nii because lii dafa important trop sa ñëw bi dafa am solo parce que nit ñi dañu war a xam yaa ngi fi loo xam ne ñu bari xamuñ ko woon surtout deret bu jege bi jeexoon nii parce que léegi nit ñi di ko weerante non loolu defi yàlla la ak nangam waaye dëgg la yëfi yàlla la waaye tam dafa am loo xam ne lii ak lii moo ko waral. So waaw it's important for you to understand. But
and sorry, not to break you in, but if there's a lot of studies, research that has been done, see relatedness when it comes to genetic disease, and all of them show relatedness that they matter.
Yeah.
The more close you are, the higher the chance of the disease manifesting, because mungsen family, mungsen direct baby pare. So let's say if I gonna yom up more one compared to so. Sorry to
basu ñu waxtaan bi du tax am ñaar ñu break waaja sey te ñu ngi nekk suñu dara ci leen jógee we're not saying that we're saying that mun naa possible it's a possibility.
Okay, so we're just saying no, especially if family bu nga xamantene maybe am na disease bu fa nekk.
Yeah.
So just ñu jéem a moytu rek but su fekkee ne dem na ba happen na ba pare lu ñu mën a def mooy you can try for IVF. Okay.
Which is?
So IVF Monica, it's a procedure where you go to the hospital as the woman and they harvest your eggs. So they will extract your eggs. I don't know what word to substitute for it. I want to maybe baby sujudongut or something, but they take it out and then call scan.
Scan?
Yeah, the egg.
The egg, sorry.
Yeah, so then your whole DNA without any mutation, everything is perfect. Ben fever nekofa, or I'm not specific fever begin at dog. And then they choose those ones. Then they put it back into the woman. You fertilize you fertilize with the male. Then you deal with from Juge. So it's a very common procedure now. No, okay. Don't you guys know about IVF? I'm getting cut it.
Interested.
No, but it's very common now. Many people knew these genetic conditions, especially in their families. That is one way to prevent it.
Yep.
Because let's say a typical example, sickle cell. Nyari carriers, you say. I'm not encouraging it, by the way. Why nyari carriers, you say, and you just want to make sure, I'm a child with sickle cell, right? So you would go, you harvest eggs, you test, and you guess, okay, this particular one, maybe this 5 or so, that mutation, that error, it's DNA, maybe. Then you're like to use, combine with the male sperm, and then put it back into the lady. So it would be, successfully, it will be a pregnancy. And then I guess the child would not. They do it in the lab. It's a lab.
Why? Edward B.
Lab.
Okay, chiwab. No.
So it's a very okay.
Papa bi mun na tok basse ki tok kunkudang xawma kudang ñu yalla dogal waaw.
But I mean they need to have the the products again.
Products directly need new develop.
Yeah, and then they need the woman to prepare it.
No.
Unless they want to use a surrogate as well. But no.
Jambar, content. Thank you so very much. Because I wish when you Amar on this platform, to be honest. You know, I'm gonna because this is very important, and I'm sure many people have learned something new today.
I hope so.
Even my colleagues have. I'm not lawyers and as well. But so what's coming up now? Because you get this awareness campaign, and then you get to hard them. Get them to other countries, and is there anything on the pipeline? Things that's about to happen?
So them going up country, and we want to collaborate to do that. So
important. That is important.
So that is very important.
They need to know about this.
Exactly. So the next step that what we are working on is to try to propose to the government to see how we can collaborate together to have these sensitization movements, I would call them. Understand? Them see there be wahag guy.
Exactly.
And then also at the same time wahag soon nurses, actually doctors, because let if they come to them. So they need to know what is happening to it. So to doctors, the nurses, which goes back to teaching teach university, we teach doctors, we teach nurses, but also to go to the rural areas. So that goes back to collaboration, because we can't at all. So we are also seeking collaboration, seeking partnerships, external and local as well, just to get this done. And also, like I was saying earlier, that the database, the psychological support, because as an association now, or let me say for now, we cannot give that psychological support just yet. So we need that expertise. I'm not a psychologist, but to do that you need qualified psychologists to provide that. So these are all collaborations that we need to foster and partnerships we need to do.
Oh, thank you so very much. Thank you for coming. Future again to give us more information. Last time you were but right now
I'm hopeful that's going to be the case.
Thank you so much. All right, that was Sainabou Laye Ndure, the project coordinator with the Global Health Network, and she's an accomplished geneticist with a deep commitment to advancing global health and promoting genetic literacy in the Gambia. We thank her for coming, and we wish you the very best of luck in all your endeavors. We're going for a short break, and then we will come back.